Now is it coming? Yes or no? Hello everyone, welcome to Pediatrics by Dr. Anand. Today we're going to talk about an image-based discussion and a last class of this month and a very good vibes to all of you. Okay. Okay, that's nice. Is my voice coming now? Yes or no? We're going to start the class. Is my voice coming now? Yes, let me know. Yes or no? Oh yeah, I can hear my own voice. Thank you very much. Yes, Unacademy is a very beautiful platform which basically connects us to be together, to live together, and to breathe together. Unacademy gives us the opportunity to share some beautiful amount of knowledge where we share some amazing one-liners, image-based questions, and like various questions from various competitive exams. It will be helpful for all of you. Okay, let's start this class. Okay, I'm connected my JBL speakers. I don't know whether it is working or not, but let's start. Okay, don't mind, sometimes it takes around 1 or 2 seconds to come to live and everything. So कैसे हैं आप सब लोग? How's everyone doing? How's everyone doing? Yes, great. Let's start this beautiful class. In this academy, first of all, my name is Dr. Anand. I'm assistant professor in a medical college. And also on Academy, we have 20% off on all the various subscriptions. All the subscription till June 20th, we have 20% off. We had our target is now NEET 2023. We have a subject-wise batch for 6 months and a high-yield revision batch for next 3 months. Good evening, Dr. Osama Sheikh, Dr. Shubham, Amrit, Shubhangi, Deepak, Priya, Orion, and many beautiful people. We have a discussion batch NEET PG 2023, for repeater students, and it's starting from July 1st for 6 months. The price is hiking very soon. If you feel to have the Unacademy plan, please have it. It will be fun. Yes, let's start this amazing class. So today's topic of choice is rapid revision image based with a lot of amazing crazy questions I have put, and it's gonna be fun. And thank you so much for all the love and support you guys have given to me on Unacademy. It has been an honor to serve Unacademy, and thank you so much for all the good vibes, and I really wish that every one of us have good vibes forever. Okay. Before starting any amazing segment, we always have a motivating quote. And today's motivating quote is very important. Scared of mistakes. Are you scared of mistakes? Are you scared of mistakes? Do mistakes. Lot of mistakes. Why? Because mistakes are a proof that you are trying. Mistakes are a proof, that you are trying. So don't really feel bad, okay, if you answer in the comment section any wrong answer or anything like that. Participate, okay. That's it. Okay, so I hope you are really strong in life. This is the last month, the last day of the month, and kal ek naya savera hoga. Tomorrow will be a new day, a new beginning for all of us, and that's what. And always remember, okay, like I there's one quote which always gets stick to me. You will never always be motivated. You will never always be motivated. So what to do for that? So you must learn to be disciplined. You must learn to be disciplined. Okay, so basically, sometimes our parents are not always with us, right, together. Our parents are not with us always. Sometimes they are busy, sometimes they are present, they are absent, but you must learn to be disciplined. You must learn how to make your own timetable and how to lead your next upcoming generation. Okay, so you never always be motivated, so you must learn to be disciplined, and I will not always be there for you. Sometimes we meet, we don't meet, we have classes, we don't have classes, so you must learn to be disciplined. Let's start the class. Yes, a recent picture of one of my patient. So could you please tell me, look at the report? Yes, exactly. Perfect. Look at the report and could you please answer in the comment section. If this CBC reports comes to me, let's just talk about it, bro. What is the first thing comes to my mind? What is the first thing as a doctor, as a brilliant, awesome, super amazing doctor? What is the first thing I must watch in this one? Okay, very good, very good. Yes. ओके शुभम कह रहा है कल का मजा अलग है हाँ जी हाँ जी ओसामा हेलो हेलो या yes exactly yeah so the first thing which can understand to my mind is can you see the hp of the patient is 8.4 gram per dl. Can I say that the patient is a case of anemia? Yes or no? Hemoglobin less than for the respective age and sex we have the hemoglobin cutoff, right? So This patient, yes, exactly, this patient will be is a case of anemia, number one. Okay, see, this is a good report. Okay, this is what you're gonna see in all your medicine postings, pediatric postings, any adult or peds postings. If a patient comes to you with anemia, the second thing which should always be watched in this picture, in this report, is MCV and MCH. Is MCV and MCH, mean corpuscular volume and mean corpuscular hemoglobin. Okay, the normal value of MCV is 80 to 100 femtoliter, whereas the normal value of mean corpuscular hemoglobin is around 30 plus minus 3 picogram. Picogram. Okay, now listen very carefully. What is the first thing you saw in the child? Hemoglobin. What did you diagnose? The patient is a case of anemia. Second thing, what will you see? MCV and MCH. Why you want to see MCV and MCH? As I can appreciate in this picture, MCV is 73.9 and MCV is 20.6. So can I say this looks like a case of microcytic hypochromic anemia? Yes or no? Don't you want to know that the which type of anemia my patient is facing? Is my patient is having macrocytic anemia, or a microcytic anemia, or a dimorphic anemia? Do you agree with this line, my dear? Yes or no? Exactly. Very good. Very good. Yes. Perfect. Perfect. So yeah, that's very well put. So number one, I'll see hemoglobin and I will diagnose the patient as anemia. Then I will see MCV and MCH, and in this case, MCV and MCH is very less. So I will say, sir, this looks like a case of microcytic hypochromic anemia, right? Now, what is the next step? Now, I have a question to you, my dear friends. What is the next step? मेरे को ये report देख के, by looking at this report, I can feel that the patient is having microcytic hypochromic anemia. What should be my next approach? The other question options are: number one, should I start iron therapy in this patient? Yes or no? Please put an answer in the comment section. I got to know that the patient is having microcytic hypochromic anemia. Should I directly start iron or should I do something? You tell me the answer. You tell me the answer. So there are students who say yes, start the iron. What will you do, guys? Anyone? Exactly. Dr. KK, we have a new member in our family. Dr. KK says that yes, exactly. So okay, see, my HOD used to say common things are common and rare things are rare, right? Common things are common and rare things are rare. The differential diagnosis, as everyone knows about it, could you please tell me what is the differential diagnosis of microcytic hypochromic anemia? I think every one of us know this one. The differential diagnosis of microcytic hypochromic anemia is nothing but we have the mnemonic known as Sheetal. Number one we have is sideroblastic anemia, sideroblastic anemia, iron deficiency anemia, iron deficiency anemia. Then we have thalassemia, right? Then also we have something known as anemia of chronic disease, anemia of chronic disease, okay, anemia of chronic disease. And the last but not the least, we have lead poisoning, right? Am I right or wrong? Is this beautiful slide making sense to you? So this is the very important, differential diagnosis of a patient basically with microcytic hypochromic anemia. The answer for the question which I asked you, should I directly start the iron? The answer will be no. You don't start the iron directly. You want to rule out that what is the cause of this microcytic hypochromic anemia. And of course, as my HOD says, common things are common. The first commonest differential diagnosis that comes to my mind is iron deficiency anemia, right? Iron deficiency anemia. I totally agree with you. The answer for the question is I would like to go for iron studies. I would like to go for iron studies. Which iron studies are we talking about? Could you answer in the comment section, please? कौन सा iron? क्या iron pro? Yes, exactly. Iron profile. क्या क्या आता है iron profile में? What all things do you get in the iron profile? Could you please tell me exactly? Yes, Dr. Amina, Ali, Kavya, Osama, Shubhangi, beautiful people answering amazing stuff. Yes, so can I write serum ferritin? Very, very important. Serum ferritin and total iron binding capacity. Like two things, there are multiple things actually. At least serum ferritin and TIPC is something which is really very important for me to understand. And as we all know, what happens to serum ferritin in a case of iron deficiency anemia? Serum ferritin decreases and total iron binding capacity increases, right? This is what happens. Are you understanding? Number one, you saw the CBC report. Number two, you saw hemoglobin. There was anemia. Then you saw the MCB and MCH. You understood it was a case of microcytic hypochromic anemia. Then this has comes to your mind, Sheetal, differential diagnosis of microcytic hypochromic anemia. Then you will go step by step. You will not directly think of thalassemia. Okay, see, getting the blood investigation, number one, even though it's you get the blood investigation in government or a private, money is being spent, right? So being a beautiful doctor, you want to wisely spend the money. Am I right or wrong? And most importantly, bro, you're pricking the patient, you're taking out the blood of the baby, right? Do you want to do you want to make that blood of some value? Yes or no? Or do you want to directly start, directly send iron profile, HPLC, serum ferritin, everything you want to start send at once? पूरा बच्चे का खून निकल आएगा. The whole blood only will come out if you start sending everything possible. Start with the common things, and if it is not fitting, then go to the next level. That's how my HOD used to say. You are not a quack, you are a doctor. Doctor is a doctor. Doctor. Doctor matlab that you make a sense of what you're sending. Okay, so that's what. So that's it. So I thought of Shubhangi thought of iron deficiency anemia, and she sent the iron profile, which has the serum ferritin, total iron binding capacity, urinary iron binding capacity, TIBC, UIBC, and everything you sent. Next question. If the serum ferritin is normal and the TIBC is normal, what is my next step? Exactly. Could you answer in the comment section? Yes, Dr. Shubham says blood is precious. Yes, my dear brother, blood is precious, and also our friendship. अच्छा होगा ना, साथ में सिंक हो गया. हाँ जी, next what? Anyone? What do you want to do next? What do you want to do next, bro? Serum ferritin is normal and TIBC is normal. What next? The next which comes to my mind is thalassemia. And for that, of course, I would like to do electrophoresis, right? You HPLC you want to do, or you want to send electrophoresis, right? Where do you want to see a fetal hemoglobin or adult hemoglobin and the ratio and stuff like that? Exactly. Perfect. Here only, just I'll see, this topic is gonna be very big, so I will not ask you everything. I'll just ask you to the point and we'll finish it off. Okay, because it's an image based revision. I have to go for the next image also. Exactly. Someone is really stressing on Menser index. Exactly. Could you please tell me what is Menser index? What is the formula of Menser index? Because it comes in exam. It's a very quick question, common question asked in exam. What is Menser index, and it helps in differentiating what? So as for this, I would like to thank Dr. Ishita Srivastav, one of my junior, one of my regular visitor of our classes. She told me, sir, Menser may first come M, so write MCV. Last come R, so write RBC. MCV upon RBC. MCV upon RBC is the formula for Menser index. That is number one. Number two, why are we doing Menser index, sir? So basically, Menser index is used to differentiate anyone thalassemia. Yes, exactly, thalassemia from iron deficiency anemia. Menser index helps in differentiating thalassemia from the iron deficiency anemia. And if the Menser index is less than 13, my patient might have thalassemia, and if it is more than 13, my patient might have iron deficiency anemia. And how will I remember? Less than 13 is thalassemia only. Less, it's written less here. So less than 13 is thalassemia, more than 13 is iron deficiency anemia. This is one thing very important you must remember. Let's go to the next slide, please. Exactly. Where do you see football sign, anyone? A quick question, please. We have a lot of images to cover today. Where do you see football sign? Who will tell me? Exactly. Football sign is seen in the case of pneumoperitoneum. Football sign is nothing but like a pneumoperitoneum, number one. Number two, where do you see? You see in necrotizing enterocolitis. We see something exactly. Yes, exactly. yes, perfect. Dr. Amritesu says, sir, if I remember, your image had less than 13 Menser. Yes, brother, yes, very true. So football, a big football sign is seen in pneumoperitoneum, nothing but a stage 3 NEC. What is NEC, anyone? NEC is nothing but necrotizing enterocolitis. Necrotizing enterocolitis. Most importantly, FMG question number one, which is the most common GIT problem, or I like to say GIT emergency in a newborn. छोटे बच्चे में पेट का सबसे इमरजेंसी वाली कौन सी बीमारी होती है? इन अ न्यूबॉर्न बेबी ऑफ अ स्टमक इशू, GIT issue. Which is the most emergency thing happens in a newborn baby? A newborn baby has only one important GIT issue. The answer is necrotizing enterocolitis, NEC, right? And what is the name of the staging for NEC? नहीं, Osama 2A में नहीं, 2A में तो न्यूमेटोसिस इंटेस्टाइनलिस होता है स्टेज 2A में। स्टेज 2 में दिस पोर्टल वेन में गैस होती है। यूजुअली हम इसको देखते हैं स्टेज 3 में, 3A और 3B तक चला जाता है ये, ठीक है। 3A में पेरिटोनाइटिस के फीचर्स होते हैं, 3B में तो पूरा का पूरा परफोरेशन ही हो जाता है, करके ऑपरेट कराना पड़ता है। ओके एग्जैक्टली हाँ, मैं इतना पसीना आया मेरे को, जिम से आती मैंने क्लास शुरू कर दी। आई हैड आलू सैंडविच, माय फेवरेट इज आलू। आई लाइक आलू, डू यू लाइक पोटैटो? आई लव पोटैटो, पोटैटो इज नाइस। ओके that's it. The name of the staging for necrotizing enterocolitis. Anyone? What is the name of the staging? कोई नाम है इसको? staging का कोई नाम होता है क्या? Yes, we have modified Bell's staging. We have modified Bell, घंटी. Modified Bell's staging is the name of the staging. Very important for nothing but necrotizing enterocolitis. For necrotizing enterocolitis. Okay, very good. Okay, next question, please. Okay, perfect. Let's go to the next question. Yes. A very I also like potato. मेरा टमी बहुत बढ़ रहा है यार, पता नहीं क्या हो रहा है आजकल। टमी की एक्सरसाइज कर तो रहा हूँ, पता नहीं मेरा टमी बहुत बढ़ रहा है, थोड़ा सा तो बढ़ रहा है। अकॉर्डिंग टू माई पेरेंट्स आई एम वीक। ओके अकॉर्डिंग टू माई पेरेंट्स आई एम द वीकेस्ट इन माई हाउस। अकॉर्डिंग टू माई मॉम I don't eat anything. According to my mom, I am the weakest. According to my mom, I'm having dark circles. According to my mom, I don't eat anything. And according to me, I eat so much. My God. बट पेरेंट्स को कौन समझाए, ठीक है। हर माँ के लिए उसका बच्चा कमज़ोर ही है, हर माँ के लिए उसका बच्चा कुछ नहीं खाता, चाहे मोटा भैंसा ही क्यों ना हो। एग्जैक्टली, सो दिस इज वेरी इंपॉर्टेंट। एनीवन? दिस इज हेयर ऑन एंड अपीयरेंस। वेरी इंपॉर्टेंटली, दिस इज हेयर ऑन एंड अपीयरेंस ऑन एक्सरे, और यू कैन से क्रू कट अपीयरेंस. Crew cut appearance is nothing but very important, seen in, you can say it is seen in thalassemia, or also in the cases of sickle cell anemia also you can see crew cut appearance, thalassemia or sickle cell anemia. Exactly, yeah, Shubhangi says that's every mom in India. That's very well put, my dear. Yes, right. Yes, anyone? Very simple answer, very beautiful answer. Okay, if I give you a hint, this is a cerebral hemisphere. This is a cerebral hemisphere, number one. Number two, very important, this looks like a puff of smoke. Puff of smoke. I don't smoke, but if anyone smoke, he or she will understand. Puff of smoke. Puff of smoke. This looks like a puff of smoke appearance. Can you please answer in the comment section? Puff of smoke appearance is seen in moya. Exactly. Yeah. Puff of smoke appearance. Puff of smoke appearance. You see in moya disease. Exactly. That's very well put. Yes, राधिका से घर घर की कहानी है। हाँ जी डियर, यू वेरी ट्रू राधिका, आई टोटली एग्री विद यू। ठीक है, परफेक्ट। सो पफ ऑफ स्मोक अपीयरेंस इज सीन इन मोया डिजीज, मोया। नेक्स्ट इंपॉर्टेंट क्वेश्चन, यस दिस इज अ वेरी कॉमन pediatric question. Name the clinical finding which you can see in the baby, and I have seen in many babies like that. Anyone can answer in the comment section. कौन है ये, क्या चीज है डियर? This is nothing but very importantly, exactly, Bitot spots. Exactly, very important. Bitot spots, yes, that's very well put. Vitamin A deficiency, that's a right idea, and Bitot spots is the right answer. And which is the dermatological problem you can see in vitamin A deficiency? Exactly, जो बहुत ही कॉमन क्वेश्चन है। Oh, is nice. डॉक्टर शुभम कह रहे हैं मोया मीन्स इन यूक्रेन एंड रशियन इज माई, क्या ब्रो पूरा लिखा क्या तूने, समझा नहीं। मोया मीन्स इन यूक्रेनियन एंड रशियन इज माई, मोया मतलब मेरा, अच्छा ऐसा करके, ठीक है। ओके, गाई गॉट इट, ठीक है। हाँ जी, यस, वेयर डू यू सी टॉड लाइक स्किन? एनीवन? टॉड लाइक स्किन विच इज बेसिकली इज अ विटामिन ए डेफिशिएंसी इशू। एनीवन? टॉड लाइक स्किन, मेंढक जैसी स्किन, टॉड लाइक स्किन, exactly, Phrynoderma is a manifestation of vitamin A deficiency, the dermatological manifestation, nothing but known as phrynoderma, nothing but toad like skin, मेंढक जैसी skin. Okay, yes, exactly. Okay, so nothing but what is Bitot spots, bro? Bitot spots are the build up of keratin. Very beautiful. Can we understand a clinical knowledge? ये जो the spots which are there, no, they are build up of keratin, which are located superficially in the conjunctiva of the human's eye. This part is conjunctiva, okay? This is the eyelid. This is a full layer, transparent layer. We have conjunctiva layer, okay, and there you have keratin deposition, nothing but known as Bitot spots seen in vitamin A deficiency. Exactly. ठीक है, Todd, हाँ अच्छा ठीक है. And can I please revise vitamin A deficiency classification? I am a FMG student. I must revise this one, dear. Could you please tell me vitamin A deficiency classification? How will I remember it? Anyone? Exactly. X1A में क्या होता है? Do you have the, okay, my question is, do you have the conjunctival involvement first or the corneal involvement first? Anyone? Exactly. You have the conjunctival involvement first. Priya Gupta is and Rameshwar Nayak is very right. Number one, conjunctiva. I told you the full covering conjunctiva. Number one, there's a dryness, conjunctival xerosis. Then we have the Bitot spots. This is a very important exam question. The exam question was Bitot spot is seen in which classification of vitamin A? मतलब Bitot spots is seen in which classification of vitamin A? The answer is X1B. In the X1B classification of vitamin A, exactly, you'll see Bitot spots. See, first there will be a conjunctival dryness, okay, and then the inside cornea will be involved, okay. Now, are you understanding? It's very easy, okay. First conjunctival dryness, then Bitot spots, फिर उसके अंदर आता है corneal dryness, then corneal ulceration. Please think and study, okay. Link and study, like try to tell, okay. The whole layer is a conjunctiva, okay. Conjunctival dryness, Bitot spots. Corneal dryness, corneal ulceration. That's it. Okay. X1A, X1B, X2, X3A, and X3B. And this is already a very important question, dear. Bitot spots is seen in which classification of vitamin A? The answer is X1B में मिलते हैं Bitot spots. Then we have XN, XS and XS. Anyone क्या होता है NSF? Yes, one is scarring, one is night blindness, and one is fundal changes. Night blindness, scarring, and fundal changes are the important points basically you must remember in a case of this one, okay? Exactly. So beautiful. Priya Gupta को सारा आता है. So nice. Indian progression answering very good. Deepak, Shubham, very good, bro. Rana K, nice, very good. Yes. Please read the question and tell the best answer. Being a teacher, you have to speak so much, no? I was thinking, no? Morning I had my hospital, huge patients, 45, 50 patients were there in our ward. Then ICU patient, that ward patient round, then ICU patient round, then SNCU round. Then afternoon again MBBS class I took in my medical college. Came back here, then 4 to 5 one class, 5:15 to 6 one class, 8:30 to 9:30 this class, then night 11 p.m. one more class. मतलब आवाज, I think voice is something which is very, that's why I keep having water every time. I should not have dryness over my throat. Exactly. Dr. Mahanul Hussain has a very beautiful answer. History of blue sclera with recurrent fracture. I must think of osteogenesis imperfecta. We had a very beautiful class a few days back on the Unacademy of the osteogenesis imperfecta. Very important. Could you please tell me the triad? Now this is a good one. What is the triad exactly? What is the triad of osteogenesis imperfecta? Exam में कैसा होएगा? Number one, osteogenesis imperfecta. What is the other name, my dear? The other name is brittle bone disease. Brittle bone disease. What is the treatment we use? Any drug? Can you tell me any one drug name? Pamidronate. Pamidronate. Okay, I told you. ये आ चुका है, ठीक है? Pamidronate is one drug which we give basically in a case of brittle bone disease. Brittle bone disease is also known as osteogenesis imperfecta. So the triad, we all know that, like history of blue sclera with recurrent fracture. Like blue sclera, I would fragile bones बोलें या recurrent fracture बोलें, same thing है. History of blue sclera with recurrent fracture and very importantly sensory neural hearing loss. Exactly. Yes. Very good. Okay, remember, whatever you are reading, bro, you are reading for the first and last time. कल से हम मिले ना मिलें, ये क्लास हो ना हो, बस आप खुश रहें और कुछ नहीं चाहिए मुझे, ठीक है. एंड ऑल्सो व्हाट इज द नेम ऑफ द क्लासिफिकेशन, एनीवन? ऑलरेडी हमारे शुभम ने बता दिया है. सो मच फ्रैक्चर इज देयर नो इन ऑस्टियोजेनेसिस इम्परफेक्टा, सो मच ऑफ फ्रैक्चर इज देयर. So what you called so the baby will be very quiet, okay, because he will have very pain, no, he'll be very silent. The name of the classification for osteogenesis imperfecta is a silence classification, silence classification. And very well put, Dr. Osama has told this what you called exactly, biphosphonates is what the drug of choice, and in that we have pamidronate. Okay, yeah, Sonal says, Sonal Narwani has a question. Yes, Sonal, आपके जवाब का आंसर तो कल पता चलेगा. कल सब पता मतलब you'll get to know that कैसे क्या रहेगा. अभी के लिए enjoy the class, that's it. So silence classification is there in osteogenesis imperfecta. Where do you see gross classification, anyone? Gross classification, can you please tell me? Gross classification, it's a very beautiful question. Gross classification, gross classification you see in tracheoesophageal fistula. Tracheoesophageal fistula में हमने भी again had a recent class on musculoskeletal system on DMDs, the TEF, na very nice classes we had actually. So हाँ जी हाँ काव्या, सस्पेंस ही है. अभी पिक्चर कल रिलीज होगी, अपने आप देख लेना अच्छे से, तुम्हें अपने आप समझ में आ जाएगा. Silence classification is seen in osteogenesis imperfecta. Gross classification is seen in tracheoesophageal fistula. And what is the name of the classification for hepatic encephalopathy? Very nice question. And अपना शुभम ये भी लिख ले हमारी किताब के लिए, टॉप 50 क्लासिफिकेशन, टॉप 50 क्लासिफिकेशन वो भी हम बनाएंगे एक, ठीक है. सो 50 अंडरस्टैंड, टॉप 50 क्लासिफिकेशन. और तूने अगर लिख के मुझे नहीं भेजा तो मैं तेरे से बात नहीं करूंगा, ठीक है. यस एग्जैक्टली, वी हैव वेस्ट हेवन क्लासिफिकेशन, वी हैव वेस्ट हेवन क्लासिफिकेशन इज द नेम ऑफ द क्लासिफिकेशन फॉर hepatic encephalopathy. Could you please tell me, to assess the severity of distress, to assess the severity of distress in a preterm, what is the name of the classification we use? Anyone? What scoring system, if you can tell me, what is the name of the classification or scoring system used to assess the severity of distress in a preterm? Amina Ali says yes, West Haven. Heaven कौन बोला? Kavya says West Haven. Kavya, it's not heaven. जन्नत में नहीं गए हैं हम लोग, वैसे जन्नत में तो हम हैं एक्चुअली, वी ऑल आर टुगेदर, वी ऑल आर वन फैमिली, इट्स मोर लाइक अ हेवन ओनली, बट दिस वन इज अ हेवन क्लासिफिकेशन, नॉट हेवन. Okay, same goes like my junior, he used to say na, my batchmate, he used to ask me, which class you have, Anand? I was like anatomy class. He's like, hello, it's not anatomy, it's anatomy class, not anatomy. And same goes like, मुझे एक और जोक याद आ गया, मैं बताऊंगा, मुझे नहीं पता, मैंने बताना है. So Sarabhai versus Sarabhai, then she used to say, no, that your friend, her name is also so middle class, and Maya says that hello, her Indravadan says that your friend, no, she has a very middle class name, her name is Rita. So then Maya says, hello, her name is not Rita, okay, it's Rida, not Rita. So same goes, this only it's heaven, not heaven, it's heaven classification, West Heaven classification. Okay, to assess the severity of distress in a preterm baby, the name of the scoring is nothing but Silverman-Anderson score. Silverman-Anderson score is the name of the classification for the assessment of severity of distress in a preterm. And someone answered Downey's score. Downey's score basically is the name of the scoring system to assess the severity of distress in a term baby. Done. अच्छा, ओहो मैंने बता दिया. Celiac disease, last question. Can you please tell me the name of the classification we see in celiac disease? Anyone? Dr. Shubham तेरे को मैं बता रहा हूँ ना, तू लिख रहा है ना डियर, ये वाला भाई मेरे छोटू, ठीक है. हाँ जी, द नेम ऑफ द क्लासिफिकेशन डॉक्टर ओसामा को आता है, हमने सीलिया की भी बहुत अमेजिंग क्लास की है, हमारी सारी क्लासेस अमेजिंग होती है मुझे लगता है. Yes, so the name of the classification for celiac disease is Marsh-Oberhuber classification. Marsh-Oberhuber classification. In that we have Marsh criteria, where we see total villous atrophy and increase in the intraepithelial lymphocytes. IEL count होता है करके. Okay, we have Ashish Singh. He says, "Hello, professor." Hello, professor. Sounds nice. It make me feel that money heist professor, smart, sophisticated, gentleman, and very wise. Yes, Mariam. Okay. So celiac disease, we have Marsh-Oberhuber classification. Marsh-Oberhuber classification is the name of the classification for celiac disease. Next question, please. Okay, if I show you this picture, a patient basically having a joint hypermobility. Could you please answer in the comment section, my dear? What comes to my mind if I talk about this specifically? Like I can say namaste sign, I can say I can tongue twist my fingers. I have very hypermobile joints. Mariam says, because you're amazing, sir. We are amazing. We are amazing. Very well put. Yes, definitely. You can say Marfan syndrome is one differential diagnosis. दूसरा क्या था? Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Marfan syndrome, very important. Okay, these two at least remember. Okay, these two you must remember. The patient will have a hypermobile joints, and that's it. Next question, please. Okay, this is my own patient which comes to our OPD. The videos have been taken after taking a proper consent. So yes, a very beautiful picture actually for clinical knowledge. A baby who is not able to get up from the sitting position. A baby who is not able to get up from the sitting position. Can you spot some sign? Anyone, what do you call this sign? A baby who is taking so much of time to get up from the sitting position. Exactly. That is a $1 million answer Metazillo has given. This is nothing but very importantly, go over a sign. Go over a sign. Point number 1. Okay. Question number 2. Go over sign is seen in which condition? Go over sign is seen in which condition? The answer will be muscular dystrophy. The answer will be muscular dystrophy. Like in the muscular dystrophies, we have many muscular dystrophy. We have Duchenne muscular dystrophy and we have Becker's muscular dystrophy. Are you understanding? So don't the take home message in this class is that not just what you called I would say not just in a case of Duchenne you see this point, in a case of Becker also, one second, एक मुझे एक चीज दिखानी थी इसमें, एक second. Not only in the case of Duchenne muscular dystrophy you see that, in a case of Becker's muscular dystrophy also you see Gower sign. So इसलिए ये याद रखिएगा कि Gower sign सिर्फ DMDs में नहीं मिलता. Remember this, that Gower sign is not seen only in DMD, it is also seen in Becker's, right? That is the take home message is that. Which one is more severe, anyone? Is the Duchenne is more severe or Becker's is more severe? Dr. Osama, could you please answer in the comment section which one is more severe? कौन बताएगा? Yes, exactly. Duchenne muscular dystrophy is most severe. The patient will be early will be on bedridden than the Becker's. Okay, and why did I pause the video here? Can you please tell me? Can you see this finding? Can you please tell me why did I pause the video over here? हम क्या देख पा रहे हैं इसमें? Exactly. I'll show you one more this also. Yeah, this one. Can you see that? Very important. Classical. We are so lucky we are studying this beautiful picture. Anyone, what is this, bro? This is nothing but pseudo hypertrophy of calf muscles. Pseudo hypertrophy of calf muscles. You must be thinking this boy goes to gym and he has a very beautiful and very strong calf muscles, but the reality is it is a pseudo hypertrophy. Pseudo means false appearance, hypertrophy means increase in the size. So pseudo, why? The reality is we think that this is a muscle hypertrophy, but the reality is the muscle has been replaced by fat. The muscle has been replaced by fat. This is known as very important pseudo hypertrophy of calf muscles. Okay, the muscle has been replaced by fat. This is just the fat. The bone muscles खोखली हो रही है अंदर से. The muscle is getting destroyed. The name itself says no, muscular dystrophy. There is a problem with the dystrophin gene. This was a FMG question. Which gene problem do you see in a case of Duchenne muscular dystrophy? Dystrophin gene, which makes the muscle. So muscle is breaking down. Muscle is converted into fat. That's why we say pseudo hypertrophy of calf muscles. And last question. सांस चढ़ गई मेरे को. Exactly. Dr. KK, did you understand, bro, why pseudo hypertrophy? आपके पूछने से पहले ही मैंने आंसर बता दिया. Why pseudo hypertrophy? Has everyone understood this much? Yes or no? क्या हुआ तेरा वादा, वो कसम, वो इरादा. Yes, exactly. Amrit Tesu कह रहा है, this looks like leg day in gym. I totally agree with you. This looks like a leg day in gym. I totally agree with you. Okay, great. So, yeah, exactly. The last question I have to ask here is this, bro, this Duchenne muscular dystrophy, is this a proximal muscle weakness or a distal muscle weakness? What will you tell me? If I say the baby is having difficulty in what you called, yes, the baby is having difficulty in getting up, is this a proximal muscle weakness or a distal muscle weakness? Anyone? Yes, exactly. So the answer is proximal muscle weakness. Yes. Yes, very true. Proximal muscle weakness. Yes, that's very well right. Dr. Shubham, lots of love. An Indian lover. It is the ID known as Indian lover. क्या हुआ तेरा वादा? Yes, bro. Yes, it's a nice song, na? Can we see what is this? A beautiful picture. I have so many videos of my patient. I love clicking clinical videos. That gives us a very real orientation towards the class. What is this, anyone? The answer is as Amrit says, leg day in gym. Do you agree? Yes or no? This is leg day in gym. Once you do a nice calf muscles, it happened also sometime. We had a patient, the same Duchenne muscular dystrophy, and such a heavy. It was a child. Okay, it was a 3-4 years old child. He was having a pseudo hypertrophy of the calf muscles, and I was feeling so jealous. I was like, this fellow has such a good calf muscle. मेरी कब बनेगी ऐसी? I was like, when will I get such a beautiful calf muscles? Like this is so beautiful shaped, you appreciate beauty, right? And I was like, I went to my gym instructor, I showed him the photo. I want this calf muscle, okay, like that. And then my HOD said, my HOD, I discussed this with my HOD. He knows that I like gymming and all. He said, this is pseudo, bro. This is pseudo hypertrophy, Dr. Anand, and you already have good calf muscle. This is pseudo hypertrophy, not the real calf. I was like, I want this only calf, no matter what. Exactly. Okay. Yeah, this was Valley sign. वो हम बाद में करेंगे once we talk about it. So many patients. Yes. What is the gene mutation in Duchenne muscular dystrophy? We have done nothing but a dystrophin gene का problem होता है. X21 dystrophin gene. Okay, remember that. Exactly. Yeah. Yes, exactly. And then is it a proximal muscle myopathy or distal muscle? You told me it's a proximal muscle myopathy. This is one amazing question. Could you please tell me, Dr. Osama, my dear Osama, आखिरी class है आज महीने की. So most common cause of death. Which is the most common cause of death in DMDs? शुभम तू लिख रहा है ना bro? हमने top 50 most common deaths भी बनानी है एक list है ना? The most common cause of death in measles is pneumonia. Most common cause of death in Turner is coarctation of aorta. Marfan is aortic dissection, like that. Yeah. The most common cause of DMDs is nothing but respiratory failure during sleep. The patient will have a respiratory failure. The patient will have a respiratory failure during sleep. Okay, this is the most common cause of death in DMDs. Okay, which is more severe, DMDs or Becker's? DMD is early onset. Very important. कहाँ चला गया? एक second. हाँ. DMDs is early onset. DMDs is more severe. The one who is early onset is more severe. ठीक है, ये हो गया. अच्छा, मैंने क्यों दिखाया ये? हाँ जी. How do you investigate this case? Amazing questions. Oh, I love it. Sometimes I teach on, like once I teach, I always watch my own videos. Okay, I always, just focus, just stare at myself and I watch my own videos. And I was like, oh my God, this is so good. Like, what do you call it? You call this heights of self-obsessions. Heights of self-obsession. Like so many, what do you call, novels of self-motivation I have read, that I'm highly obsessed with myself. Sometimes I feel that, like I always talk about self, discipline, self, center of mind, think happy, be positive and all. Good vibes, spread good vibes. When you smile at someone, when I smile at I enter my gym and I shake hand and I hug my gym instructor, like he feels so good. He was like, you are Dr. Saab, you're always very happy. He's like, Dr. Saab, you're always very happy. And I was like, yeah, bro, life is short, bro. Just chill, just be happy. And then very happy, I will ask him, which exercise are we going to do today? He's like, today you will do legs. Today is your legs exercise. Then whatever happiness I have in my face, फिर मैं मुंह बना के करता हूँ एक्सरसाइज. उसके बाद तो भगवान जानता है क्या होता है. Yes, exactly. Yeah. So the problem is, yeah, exactly, bro. Could you please tell me how do you investigate this case? Hello, investigation choice. बातें चलती रहेंगी. बातें ये प्यारी प्यारी चलती रहेंगी. बताओ आगे. The answer is, see, dear, it's very easy. Okay, muscle dystrophy. Which topic are we reading? Duchenne muscular dystrophy. Muscle is getting breaking down. Muscle is getting breaking down, right? So CPK levels. CPK level sounds a very nice option. Okay, CPK level sounds a very nice option. Creatinine phosphokinase. We must understand whenever the muscle breaks, CPK levels कराएं आप, ठीक है? Get CPK levels done. We have CPK MM, CPK MB, and CPK BB. M is the muscle, B is the brain, and MB is the muscle and the brain. मतलब CPK MB levels कराते हैं हम. We get the CPK MB levels done in a case of Duchenne muscular dystrophy. Why? Because bro, like whenever the muscle breaks down, no, CPK level is something which gets very highly elevated. And if I show you this amazing $1,000,000 picture, can you please exactly? Okay, yeah. Luckily, we don't have any patient's name, right? Yeah, right. Okay, Hanji, creatinine phosphokinase. Can you please see this picture? कितना है? कौन बताएगा? How much is the CPK levels? Creatinine phosphokinase? For 1,000, no, 14,402. 14,402. And the normal level is 30 to 200. 30 to 200, like 200 is the maximum you can go. It's 14,000, bro. Can you imagine? Hello, can you imagine? The muscle is breaking down very badly. So it's written, can you please beautifully spread good vibes and good knowledge? It's written, measurement of creatine kinase are used in the diagnosis and treatment of muscle disease and myocardial infarction. If someone is having a heart attack, anyone, I have a question to you guys. If someone is having a heart attack, like MI, adult patient coming to you with casualty, chest pain, chest pain. So what investigation do you want to get it done? Can anyone answer in the comment section, please? When I was an intern, my SR used to say, do this investigation very fast, okay? If the patient is having, really the patient is having MI or myocardial infarction or the heart muscle breaking down, what levels you want to get it done? Anyone? Anyone? Exactly. हमारे पास एक किट आती है Tropty. Yes or no? Do you know that, right? Tropty, it has that colors, no? 2 line, 1 line like that, positive and negative. So troponin T, Tropty. If the muscle is breaking down, my Tropty levels, Tropty will be positive. And of course, you'll get an ECG done. There's no doubt about it. And cardiac enzymes, and Tropty is important. In a case of MI, Tropty is important, and same CPK, MB and MM and MB, BB in a case of Duchenne muscular dystrophy. Okay. Yeah. Could you please answer in the comment section now? This one, bro. Anyone? What is this disease? अच्छा मैंने पुराने comments तो पढ़ लूँ एक बार. एक second रुको. कहाँ है? Okay. Okay. We have someone who says you can do it when you're already perfect. Okay. Sir, is it a genetic cause? Can transfer from parents to children? Yeah, it's a genetic kind of issue with a gene mutation. Mariam says such nice thoughts. Awesome. Thank you so much. Exactly. The best answer for this question is like इसको बोलते क्या हैं? Exactly. इसको हम बोलते हैं rachitic rosary. Can I write over here rachitic rosary? Okay, rachitic rosary. कौन से वाला है sir? Sir, which one is rachitic rosary? This one, dear. This. Can you see that at the costochondral junction? At the costochondral junction, this this bead, round beaded appearance is at the costochondral junction is known as rachitic rosary. Done? Yeah, this also very beautiful picture. This one, bro, is nothing but rachitic rosary. ये वाला, okay, rachitic rosary. Done. Next question, please. You know this app already. Next one. This was the recent NEET PG question. Anyone quick answers, please? Do you like the necklace? The only highlighter I have it over here. Yes, exactly. Now, you're right, bro. You're right. So I hope you guys are enjoying the Pediatrics by Dr. Anand classes, and this is the last class of this month, and the month is coming to an end, right? And tonight we have a class. Tonight we have a class at 11 p.m. We have the last class because today is 30th. 11 p.m. We have a class on the Unacademy. We have a quiz contest tonight. The first prize is rupees 500, and it's like a rapid quiz. The topic is vaccines actually. Vaccines पे हमें quiz करना है. A quick 30 minutes quick session. Do you like her necklace? The answer is this looks like a case of vitamin B3 deficiency. Which is vitamin B3? The answer is niacin. Niacin deficiency cause what? It cause something known as pellagra. Pellagra, right? And pellagra, basically the patient will have a rash on the sun exposed areas. On the sun exposed areas, basically someone like who is covering the whole body, but the neck will be exposed by the sun. So the sun exposed areas, you will have this dermatological problem known as nothing but pellagra. Pellagra is vitamin B3 deficiency, and vitamin B3 is nothing but niacin. Which one is vitamin B5? Anyone? Which one is vitamin B5? Pink color, nice color. Which is vitamin B5? शुभम बिल्कुल ठीक बता रहा है. Farmers, in the farmers you will see rash over here, and sometimes they put dhoti little above. Okay, farmers while farming they put their dhoti little above, so you can have this rash over the knee joints also, lower limbs also, because that part also is exposed to the sun. Vitamin B, कहाँ चला गया? एक second. Vitamin B5, yeah, vitamin B5 is nothing but, very importantly, pantothenic acid. Vitamin B5 is pantothenic acid. And this pellagra, my question is, this pellagra is seen in which one? Like the staple diet will be what if I have a pellagra? What staple diet? Which people having some specific diet can have this problem? Yes, the answer is maize, makka, maize, bhutta. Bhutta जो होता है ना, bhutta, makka, makka नहीं, bhutta, corn. Do you like corn? Corn is nice. इतना पानी पी लिया आज मेरा पेट ऐसे निकला हुआ है, पेट एकदम बाहर, लगता ही नहीं कि मैं जिम जाता हूँ करके. या एग्जैक्टली. Yes, maize is the right answer. And और कुछ बोल रहा था मैं. हाँ, so in the areas in Africa or some specific areas where the staple food or staple diet, staple मतलब जो regular diet, our staple diet is roti, chapati and all that. Then the South Indians have staple diet as rice. So this African and many other continents have a staple diet as maize, corn. So वहाँ maize is deficient in vitamin B3. Someone who is on maize diet will have vitamin B3 deficiency known as pellagra. Yes, what are the drugs given intratracheal? What are the drugs given intratracheal? You have 5 seconds to answer this question. Anyone? Yes. Very good. वो मेरा बैटरी खत्म हो गया. कौन सा मोड़ आया जिंदगी के सफर में, बस गया तू ही तू अब तो मेरी नजर में, दिल की हर एक धड़कन तुझको पहचानती है, तेरा हो जाऊंगा मैं तू नहीं जानती है. The mnemonic of this condition is nothing but nasal, as we all know. The drugs given intratracheal are, the mnemonic is nasal. N for naloxone, very important. A for adrenaline, very important. S for surfactant. A for atropine. And L for lignocaine. L for lignocaine. Yes, is the one. Exactly. Yes. Yeah. So yes, naloxone, adrenaline, surfactant, atropine, and lignocaine are the drugs given intratracheal. Remember them, okay? Dr. Priya says your voice, आवाज में जादू है तेरा ही जादू जो मेरे दिल पे छाने लगा. ये मूवी देखी थी, ये मूवी बहुत अच्छी है. यू हैव सीन दिस मूवी? और शुभम, कौन सी मूवी है ये वाला, वो रानी मुखर्जी और आमिर खान की, जे जादूगर नहीं, वो जादू है तेरा ही जादू. बड़ा प्यारा गाना है, आज मैं सुनूंगा लाउड वॉइस में. आई हैव दिस मार्शल स्पीकर्स, दे आर अमेजिंग. यू मस्ट हैव मार्शल. आई हैव अ वायरलेस मार्शल स्पीकर and it's crazy. Make a list of things in your life, which are not very expensive but moderately expensive. Make a list of what you want, focus your good vibes on that specific thing, and in the end you will buy that thing. You will start saving money for that. You will start seeing advertisement of those things. You will start seeing discounts of those specific things, and you will buy that thing. Marshall speakers are really nice, and it's very good quality. Exactly. And they are always in my washroom, always loud music, full dum 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 like that. My mom is always parishan. Yes, exactly. So Gulam movie. Yes. What is the normal blood pressure of a 4-year-old child? So I must remember the expected systole, the formula to calculate the systole and the diastole. Like, most importantly, remember the formula for expected blood pressure. Imagine this is a 4-year-old, right? If a 4-year-old baby is coming to me with casualty, a 4-year-old child, very quickly, if I want to know that what should be the expected blood pressure of this child, the answer is 90 plus H into 2 for systole and 55 plus H into 2 for diastole. Yes, exactly. 90 plus H into 2 for systole and for 55 plus H into 2 for diastole. The best answer already some beautiful person has given. सही आंसर सिर्फ एक ने दिया है. कहाँ चला गया, सॉरी. द राइट आंसर हैज बीन गिवन ओनली बाय वन पर्सन, दैट इज अमीना अली. आई एम गोना राइट योर नेम. दैट्स वेरी गुड, डॉक्टर अमीना अली. वेरी ब्यूटिफुली यू हैव told the answer, Dr. Amina Ali. 98 by 63. Okay, very beautiful picture. Can you please answer in the comment section? Comment section, please. क्या है ये? 5 more minutes and this class is over. बातें बातें में खत्म हो गई. Yes, exactly. Yeah. we have a ID. The ID name is, we have a ID. I need to tell you, the ID name is none of your business. Like, this is the name of the ID. Very classy ID. The ID name is none of your business, and that ID says, हाउ यू आर टीचिंग सो कूल, क्लास में आकर जाने का मन नहीं कर रहा, यू स्प्रेड पॉजिटिविटी. येस माई डियर, आई थिंक द लाइफ इज ऑल अबाउट पॉजिटिविटी फ्रेंड्स. आई एम रियली टेलिंग यू, सब यहीं छोड़ के चले जाएंगे, सब कुछ नहीं रखा किसी भी चीज़ में. बी हैप्पी, बी पॉजिटिव, चिल, just enjoy, you don't need expensive things to enjoy. You can just sit and talk and enjoy. You can listen to a nice song and enjoy. You can talk to your best friend and happily have a good time and enjoy. You can work out in gym and feel yourself good and positive and improving nicely. You can enjoy, right? No, we are talking and having a class. It's been 1 hour. It's been 60 minutes. We are talking about something, back to back images and all. When we are chatting, this, that, enjoy, right? We are enjoying, right? Exactly. Please remember, always be positive and happy in life. And while studying also, try to have a calm and a little positive, little happy. When you sit and study, you should be little crazily happy. Okay, I know it's difficult, but try and try, because मुंह बना के पढ़ोगे तो मुंह बनाए हुए नंबर आएंगे, मुंह बना के पढ़ेंगे तो मुंह बनाए हुए नंबर आएंगे, खुश होके पढ़ेंगे तो लाइट हैप्पी नंबर्स आएंगे, राइट? Yes, exactly. Sitting with support. Anyone? Yes, exactly. Sitting with support comes by 6 months, and sitting without support comes by 8 months. Sitting with support comes by 6 months. Sitting without support comes by 8 months. Very, very important. Okay, perfect. Next important one. Yes, exactly. We have done this picture before. Can you please answer in the comment section? This baby is having temperature 36.1. This baby is having temperature 36.1. Could you please tell me, is this looks like a case of, I would say, mild hypothermia, moderate hypothermia, or severe hypothermia? Exactly. ये 2 साल से 12 साल तक के बच्चों का है. डॉक्टर अमृत, 2 साल से 12 साल तक के बच्चों का बताया था मैंने आपको, वो फॉर्मूला जो वो वाला भी बताया था ना, 2 साल से 12 साल का ब्लड प्रेशर का. Yes, Indresh will have a nice song in the end also. No problem. मुझे पुराने गाने ही आते हैं, पर I only know old songs, bro. I really don't know the new ones. I'm still memorizing the new ones, but I end up singing the old ones only. तन्हा जिया ना जाए, तन्हा जिया ना जाए, बिन तेरे ओ मेरे साथिया. Exactly. कौन बुला रहा है मुझे? Exactly. Okay, so that's it. This looks like a case of mild hypothermia. This looks like a case of mild hypothermia. Mild hypothermia is also known as cold stress. Mild hypothermia is also known as cold stress, and the temperature of mild hypothermia is axillary temperature between 36 to 36.5 degrees Celsius is known as mild hypothermia. Mild hypothermia, right? Perfect. Very good, very good, very good. Yes, very beautiful. Let's go further. Yes, a very important syndrome. The highlighter for this syndrome are, number 1, the patient is having macrocephaly. The patient is having macrocephaly. Number 1, pointed chin. Pointed chin. and also the patient is having flushed cheeks. Flushed cheeks. Anyone, any quick answers, please? The class is coming to an end now. It's been 60 minutes. We are chatting and chatting and talking. Exactly. हाँ क्या सर, आपका 2 वर्जन ऑफ बिन तेरे हाय एक बार गा दीजिए. गाता हूँ bro. अभी अभी करता हूँ, अभी गाता हूँ. सो 2 हैं. पहले इस सिंड्रोम का नाम करते हैं. तुम भी ना मेरी तरह बातें ही करते हो, बाय गॉड. वैसे से बातें करते रहे ना, मजा आता है. मुझे बड़ा मजा आता है बातें करना, मुझे बहुत पसंद है. लाइक यू नो, विद माय बेस्ट फ्रेंड, आई ओनली हैव वन बेस्ट फ्रेंड, सो विद हिम आई कीप टॉकिंग. आई जस्ट यू नो, आई जस्ट सिट एंड आई जस्ट talk and my friend is like, Anand, you talk too much. Like, don't you get tired? I was like, I always tell, you know, I want to do this. I want to buy a BMW. I want to buy a top class apartment. I want to buy a private jet. Private jet कितने का आता है? Then I'm doing Google. Okay, like I'm so crazy. I'm doing Google Delhi to Goa flight. I was just booking recently to. I wanted to take a break, so I went to Goa. So I was checking the flight. This one, SpiceJet and all that. 3,000, 4,000, 5,000, 8,000 and all that. Then I was like, who will go in flight? Private jet. Delhi to Goa, make my trip private jet. 12 lakh रुपए, 12,70,000 rupees is the price for Delhi to Goa in a private jet. And there was the name of the private jet and how many seater is that. It was written very nicely. Okay, it was written that what time the pilot will come, he'll pick you up from the house, like pick and drop and this and that. And I was like, 12 lakh. I was 12 lakh rupees from Delhi to Goa. I was like, when will I have that much of money of 12 lakhs from Delhi to Goa in a private jet? I was like, ayo, this Akshay Kumar, all heroes have good money, yaar. And you also should have it, no? Don't you guys want to have that life? I want to have that life. Don't you want to have that life? Or you want to only study, earn, and be the best of the best? This case looks like to me as a case of Soto's syndrome. Okay, this case looks to me as a case of Soto's syndrome. What is a Soto's syndrome, sir? So, this patient has macrocephaly, pointed chin, flushed cheeks. This baby will be a large for gestational age baby. Large for gestational age baby. This baby will have a natal teeth. This baby will have a natal teeth. Okay, so that's what. So these are the very beautiful causes of Soto's syndrome. Soto's. Yes. Very beautiful picture, bro. Very beautiful picture. This class is coming to an end now. This class was 30 to 60 more seconds. Then this class is over. So you have 5 seconds to answer this question. What is this? Exactly. And वो 2 version वो थे. एक था बिन तेरे कोई खलिश है हवाओं में बिन तेरे. So one pitch is bin tere and the other pitch is bin tere कोई खलिश है हवाओं में बिन तेरे. So yes, this is thanatophoric dysplasia type 1. Dr. Osama, it's not type 2, bro. It is type 1. Type 1. Okay, so that's what thanatophoric dysplasia type 1 is. The X-ray of the choice is nothing but telephone receiver femur. Because why specifically I'm saying type 1, my dear? Because type 2, the femur will be normal. The patient will have a normal fever. I'm saying femur. Yes, exactly. Yeah, exactly. So so normal femur is seen in thanatophoric dysplasia type 2, and in the type 1 you will see this telephone receiver femur. Okay, this part we have already done actually. What is this milestone? Yes, what is this milestone? Anyone? Yes, this is nothing but bye. When can a baby say bye? Anyone? The answer is 9 months. But Osama, you're answering very good, bro. अच्छा गलती करी. अब याद रहेगा ना कि type 1 में होता है, dear. Type 1 will have a thanatophoric dysplasia, है ना? This is important. Okay, yeah. Where do you see molar tooth sign? Anyone? Where do you see molar tooth sign? Molar tooth. Anyone? Yes. है क्या ये जो तेरे मेरे दरमियां है? Yes, molar tooth sign is seen in Joubert syndrome. Okay, molar tooth sign is seen in Joubert syndrome. Remember that. Okay, this part is done. Very nice question. Eye of tiger sign बहुत पुराना है ये. Eye of tiger sign. Yes, शुभांगी कह रही है म्यूजिक क्लासेस लेने आ रही हूँ मैं. आपकी इतनी मीठी आवाज़ है, आप अपने इंस्ट्रक्टर से लेते रहो, फिर हम दोनों गाएंगे, विल हैव अ क्विज कॉन्टेस्ट, ऐसा कि चलते हैं क्विज कॉन्टेस्ट करने, है ना? एग्जैक्टली। Exactly. Eye of tiger sign on MRI. Can you please tell me, bro? This is the eye. This is the muche of the tiger. Yes, eye of tiger sign. Very importantly, eye of tiger sign exactly is seen in PKAN, bro. PKAN. Yes, Kavya is right. Right. Pantothenate kinase associated neurodegeneration. Pantothenate kinase associated neurodegeneration. Eye of tiger sign on MRI. Yes, my dear Priya, ये important है dear आयो में एग्जाम में। मैंने पीजी बुक्स और सारी नेल्सन से देख देख के ये बड़ी मुश्किल से नोट्स बनाए हैं, ये आए हैं क्वेश्चन डियर, ये आए हुए हैं एमआरआई में। ये सब इनबॉर्न एरर्स ऑफ मेटाबॉलिज्म है, दीज ऑल आर आईईएम टॉपिक्स, इनबॉर्न एरर्स ऑफ मेटाबॉलिज्म। सो नो वन एक्चुअली गोज इन सच अ डेप्थ ऑफ द टॉपिक, बट आई हैव गॉन एंड टेकन आउट द क्वेश्चंस. So just remember, eye of tiger sign on MRI is seen in PKAN. PKAN is pantothenate kinase associated neurodegeneration, right? Yes, exactly. हाँ जी, अच्छा, वी हैव अ आईडी, शी सेज सर आपकी क्लासेस कब कब लगती हैं? मेरी क्लासेस सुबह को, दोपहर को, रात को और अर्ली मॉर्निंग लगती हैं। इतनी नहीं लगती, 2-3 लगती हैं। आप जब आएंगे तो आपको पता लग जाएगा रेगुलरली। ओके, आई ऑफ टाइगर साइन इज सीन इन PKAN, pantothenate kinase associated neurodegeneration, and it is also known as Haller-Warden-Spart syndrome. Haller-Warden-Spart syndrome. Many of our dear students have what do you call it, this one, Haller-Warden-Spart syndrome. The class is coming to an end, guys. Yes, beautiful slide. Tram track appearance, tram track, ये सारे questions important है bro, please remember. We are fortunate, we are together and doing this rapid revision image based class, which is important. Okay, so where do you see tram track sign? Anyone? Tram track sign? Yes. तड़पाए मुझे तेरी सभी बातें, एक बार है दीवाने, झूठा ही सही प्यार तो कर, मैं भूली नहीं हंसी मुलाकातें, बेचैन करके मुझको, मुझसे यूं ना फेर नजर. Yes, tram track appearance, bro, it is seen in 7 conditions. Tram track appearance is seen in 7 various conditions. At least one you should remember, that is Sturge-Weber syndrome. Sturge-Weber syndrome is important. From tomorrow we're gonna have cardiology classes actually, and followed by neurology classes and neurocutaneous syndrome, where you have the neurofibromatosis type 1, von Recklinghausen disease, and Sturge-Weber syndrome and tuberous sclerosis. वहाँ पे ये आएगा tram track appearance. Tram track appearance. Yes, Sturge-Weber syndrome. Last question on this planet. Let me ask you a tough one. ये तो सबको जानते हैं, सबको पता है ये वाला तो. Let me ask you a difficult one, please. No, difficult one. Exactly. What is this? हाँ, तमिल वाला मुझे पता नहीं है ना, मैं सीखूंगा। शुभम सिखाएगा, मुझे भेज दियो। शुभांगी तुम भी कोई अच्छा सा भेजना। ओसामा बेचारा, मुझे ओसामा जो है रिक्वेस्ट करता रहेगा मुझे, नए गाने सीखो, गाना बहुत अच्छा गाते हो, नए गाने सीखो। एंड आई एम ऑलवेज टेलिंग ओसामा, हाँ मैं सीख रहा हूँ, या आई एम लर्निंग, नो आई लर्न। टाइम ही नहीं मिलता यार, टाइम ही नहीं मिलता, दैट्स द प्रॉब्लम। क्योंकि वो जाता है ना, बिल्कुल देखो, आप खुद ही देख लो क्लासेस कैसे चलती हैं। आई वॉन्टेड टू ज्वाइन दिस वन, आई एम ऑलरेडी गोइंग टू डांस क्लास, जिम आई एम गोइंग Monday to Friday, Saturday Sunday I go to dance classes, but this singing classes, like I don't know, but like I'm not getting time. And secondly, my throat, because we take so much of classes yaar, so much of speaking, you have no idea. फिर उसमें गाने का ना, it will be tough, I guess. My voice will go down, बैठ जाएगी मेरी आवाज, right? Yeah, this is the club foot, bro. This is the CTEV, like a congenital club foot, congenital talipes equinus varus deformity. Exactly, that's what. Yeah. So okay, we say she says, sir, sorry for my user ID. नहीं, अच्छा है, बहुत अच्छा है dear, वो मुझे तो बड़ा अच्छा लगा, अच्छा आइडिया आपका. The ID name is none of your business. Okay. That's great. Very beautiful picture. What is this again? Photographic memory. This is the last week I updated in my slides. This is again a club foot. This is the beautiful club foot. Please remember club foot. Thank you, Mariam. Thank you so much. So kind of you. Thank you, Mariam. Yeah, this one also dear, club foot. ठीक है, club foot. That's it. चलो बस करें, क्लास बहुत देर हो गई, अब जाएं अपने अपने घर, चलो गो। इतने सारे बच्चे ऑनलाइन बैठे, 1 घंटा हो गया। डोंट यू गाइस गेट टायर्ड? डोंट यू गेट टायर्ड? ओ गॉड, व्हाई 1 hour you are still sticking like a bubble gum? Don't you not tired? Go, bye, go. अच्छा last slide, ठीक है, last, we'll finish it off. Very nice question for FMGs, and this was the question for PG also. Blue color cannula. Blue color cannula is which number? Blue color cannula is which number? Please tell me. Exactly. क्या है? Shout out भी मिल गया मुझको, क्या अच्छा या so blue color cannula, my dear, blue color cannula is 22. Blue color cannula is 22. अमृत bro is 22 dear, ठीक है अमृत, याद रखेगा तू, ठीक है 22, ठीक है या अमृत, you are there in my group, right? You are really oftenly your name is coming, you are really answering well. ये 20 कौन बोल रहा है? शुभम 20 है बेटा, घर पे आके मारूंगा मैं, 20 बोला तूने, 22 है शुभम, 22. Blue color cannula is 22 bro, and yellow is 24. What about purple? Purple is 26. Okay, blue color cannula is 22, yellow color cannula is 24, purple is 26. Anyone gray green? Yes, pink. प्रिया कह रही है पिंक, पिंक तुम्हें बड़ा पसंद है पिंक. ग्रे ग्रीन बताओ पहले. 16, 18, 16, 18. Gray, green, 16, 18. Exactly. Then you can say pink. Pink is 20. That's very well right. Pink is 20. All the cannulas are even numbers except anyone. All the cannulas are even number except कोई रह गया है? Did we leave anything, my dear friends? Yes or no? Exactly. Very good. So blue is 22, yellow is 24, gray is 16, green is 18, purple is 26, पिंक इज 20, एंड दुनिया का सबसे सुंदर कलर कौन सा होता है? वाइट. सो वाइट इज 17. वाइट इज द वन विच इज ऑड नंबर. ओके, वाइट इज 17 नंबर. कौन, किसने बताया ये आंसर? किसी महान व्यक्ति ने बताया है. हाँ जी, अमीना अली, वेरी गुड. राना के, यस, वेरी गुड. सो अमेजिंग पीपल आर आंसरिंग. सो आई रिपीट अगेन. 22 इज ब्लू, 24 is yellow, 26 is purple, gray is 16, green is 18, pink is 20, white is 17. White is 17. Remember, okay, white is 17. Okay, this is a very beautiful slide. This 14, 16, 18, 20, 22, 24, 26. Violet बोलो या purple बोलो चलेगा, ठीक है. कई लोग violet कहते हैं, कई लोग purple कहते हैं. This is the color. In the AIMS paper they had asked the flow rate also. One of my junior, she told me कि सर AIMS में flow rate भी पूछा गया था. भला हो उस इंसान का जिसने इसको याद किया होगा. Great is that person who had learned the flow rate numbers. Is very kind of crazy. So that's what. Okay, this is good. Okay, oh, this is nice picture. This is such a cute picture. My favorite. This is my first patient. This is my first patient actually when I was doing my first year residency in MD in TMU, MD Pediatrics. This was the first baby we treated, and then that time I realized that I love pediatrics. My mom says you are a child only. My mom says, okay, who will come and show you the patient? You talk like a child, you act like a child, and the people will come and show you. And then the reality is everyone comes and show me because the mom and dad feels very happy. Doctor बहुत jolly nature का है, so baby also will be in jolly hands. So positive, good vibes, they spread nicely. Last question. Which question should I ask? Okay, this is easy. Almost everything is over. What should I ask you? Okay, last question. This one, then this class is over. Okay, मम्मी बुला रहे हैं, मेरे को जाना है अब. हाँ जी, yeah. Okay, we have Indresh Verma who says, I am UG student in TMU, sir. UG student, TMU. Okay, that's great, bro. I have passed my MD from TMU only. I'm very happy to see you. वहाँ मेरा नाम लिखा हुआ है, पता है? मेरा नाम पढ़ना वहाँ पे, वो उसमें ना academics में है, मेरा नाम बड़ा लिखा है वहाँ पे. मैं तुमको फोटो भेजता हूँ. बड़ा मजा आता है बताने में. Yeah, so that finishes this class, and this case is a case of rickets. This is nothing but I can appreciate. ये जो क्या है bro, ये क्या है? So this is nothing but cupping actually. This is sir, ये ना cupping लग रहा है मुझे. Cupping and fraying. Okay, FRAYING. Cupping. ये है ना dear, ये वाला देखो, ये this one. This is cupping, like a cup shape, like a cup shape. Okay, and this burnt part, this looks like a burnt, like a burnt part. This is the fraying, and next last is the splaying. Splaying is nothing but widening of wrist. That finishes this class. That finishes the last YouTube class of this month on Unacademy. I had a great time. Thank you so much everyone for this wonderful participation. I hope you had a beautiful time. and I also had a great time. Thank you so much. And yes, before leaving, a very last very quick song जो आपने सुना हुआ है शायद, कौन सा सुनाओ? Okay. तुझको देखा तो ये जाना तू ही मेरी मंजिल है, सांसों के बिन शायद जी लूं, तुझ बिन जीना मुश्किल है, मौसम भी उसमें रंगता है, जिस रंग में तू आ जाए, तेरी सुबहें और शामें हैं मेरी पलकों के साए, सीने में दिल है, दिल में है धड़कन, धड़कन में है तू ही तू, सीने में दिल है, दिल में है धड़कन, धड़कन में है तू ही तू, ओ मेरी पहली तमन्ना है मेरी आखिरी आरज़ू, love you. Thank you everyone for this wonderful participation. We're gonna sign out, and yes, Dr. Indresh, just type pediatrics by Dr. Anand and you will get it. Okay, हाँ जी, ओसामा ने आंसर दे दिया है डॉक्टर इंद्रेश आपका. थैंक यू सो मच पांडे, मरियम, एवरीवन. प्लीज टेक केयर ऑफ योरसेल्फ एंड व्हाट एल्स, या last tonight we have a class at 11 p.m. Tonight 11 p.m. we have a test on vaccines on our Unacademy app, a quick 30 minutes test, and we're gonna have a great time. Thank you. बहुत देर हो गई है, अब जाओ. Bye bye bro, take care and remember, smiling, happy, you will never always be motivated, so you must learn to be disciplined. Okay, get a rank 1, come meet me, and we all will live a very happy life ever after. Bye.